Ever wondered how calcium channel blockers, or CCBs, manage to keep our hearts ticking along at a steady pace? How do these tiny powerhouses manage to prevent arrhythmias, lower blood pressure, and even stave off angina? Well, today we delve into the fascinating world of calcium channel blockers to answer these questions and more. Firstly, let's demystify what a calcium channel blocker is. As the name suggests, these drugs block calcium from entering cells of the heart and blood vessel walls. This results in less forceful heartbeats and a broadening of blood vessels, which in turn lowers blood pressure. The pharmacology of calcium channel blockers is a step-by-step process. It begins with the inhibition of calcium ions from entering the slow channels or select voltage-sensitive areas of vascular smooth muscle and myocardium during depolarization. This produces dilation of the main coronary and systemic arteries and decreases myocardial contractility. To put it in simpler terms, the calcium channel blockers work by relaxing the muscles of your heart and blood vessels. This happens as they prevent calcium from entering the cells of the heart and artery walls. With less calcium, the heart and arteries can relax and widen, allowing blood to flow more easily and reducing the heart's workload. Let's take amlodipine, for instance, a commonly prescribed calcium channel blocker. The typical daily dose for amlodipine ranges from 2.5 to 10 milligrams. But like with any medication, the exact dose will depend on the individual patient's condition and response to treatment. Now, what about interactions with other drugs? Well, calcium channel blockers can interact with a variety of other medications, including beta blockers, digoxin, and statins, to name a few. For example, when taken with beta blockers, calcium channel blockers can cause a drop in blood pressure, slow heart rate, or an increased risk of heart failure. As for side effects, calcium channel blockers are generally well tolerated. But like any medication, they aren't without their potential downsides. Some patients might experience dizziness, flushing, or a headache. Others may have swollen ankles or feel unusually tired. When should these drugs be stopped or held? It's a question that comes with a multitude of answers, depending on the patient and the specific drug involved. But in general, abrupt discontinuation should be avoided unless absolutely necessary due to the risk of acute withdrawal symptoms. And so, to summarize, calcium channel blockers work by inhibiting the influx of calcium ions into heart and blood vessel cells. This results in a relaxation of the heart and arteries, allowing for easier blood flow and a reduced workload for the heart. They can interact with a variety of other medications and can cause a range of side effects, but are generally well tolerated. So the next time you're holding that little pill in your hand, you'll know the immense power it holds. It's not just a pill. It's a finely tuned, precision-engineered piece of pharmacology designed to keep that heart of yours ticking along just as it should.